this information is as of 4/16. The statistics and data might be a little off. Obviously, some facilities closed, some facilities open, but we are approximately 125,000 dialysis patients. In regards to the coalitions and the OKR, I'm sorry, the projects that you are affiliated with CMS, we have the transplant, you have the wait list, and those that officially been transplanted. Home dialysis, which is incidents and transitions, hospitalizations, inpatient. Now, there has been some changes recently to the CMS goals. Now you're being monitored for inpatient and ER visits, not so much readmissions now. Vaccinations, we are looking at influenza and pneumococcal. Patient and family engagement. For those that are not aware, patient and family engagement is when you are have a patient in your facility that's registered within a Caspio system that assists with any type of, or has volunteered their time to be the advocate for your facility for the patients. We request that the patients join the QAPI meetings, life planning, and of course be engaged during their monthly PFR calls. And then of course you have data and quality, which is your 2746 forms, your 2748 forms, and then of course the end of the year dialogue, which is the 2744s. The updates and initiatives, recently we have included health equity and class. And for those that may not be aware of culturally and linguistic appropriate classes or services, we're talking about everything related to making sure patients have, if they have language barriers, providing the resources and the tools for them to assist, making sure they're getting quality care and fair care, health literacy, and of course making sure diversity and belonging is happening within your facility, not only just for patients, but also for the staff. So again, the goal is to provide every patient with the opportunity to attain his or her full health potential, and no one is disadvantaged from achieving this potential because of social position or socially determined circumstances. Okay, so what does a communicate coalition work consist of? The coalition normally consists of a 6-month program. Basically, we are trying to mitigate any barriers that you might have in your facility. So obviously for vaccination purposes, you want to make sure there's an increase in an uptake in your vaccines, be it influenza, making sure that patients are getting their pneumococcal, COVID intake. Obviously post-COVID, I know that fatigue and hesitancy and trust in the medication continues to be a barrier. However, the process of the coalition is to find that barrier and try to mitigate it as much as you can, at least to see any improvements. So we go through what we call a plan, do, study cycle, which is that 6-month program. In the beginning, we start with the RCA, and we talk about going down to the root cause analysis. So what we consider like deep diving into your system, or deep diving into your data, deep diving into your patients, deep diving into any hiccups you might have within your protocol. It's the 5 whys. We have this currently on IPRO Learn, and it's basically asking like a child, why? So we have vaccine hesitancy. Why? Patients are scared to get vaccines. Why? Because they're scared of needles. Why? So we're kind of digging deep, and we want you to get down to the root cause of a lot of the barriers that you may be experiencing. Once you've completed the root cause analysis, like I mentioned, is available on the IPRO Learn system, and it starts at effective October 1, and we're going to run until the ending of November. We go and transition into the PDSA cycle, which is your plan, do, study, and act period. And so at that point, it's the 4 stages. We do 1 stage per 30 days, where you're kind of looking at all areas of your barriers and you plan accordingly. So that's the first portion of the PDSA cycle. Here is just a viewing of what the plan, do, study looks like. Obviously, the first point, we're going to be doing the plan. We need to make improvements. Where are we making improvements? In healthy living. It's not just vaccines. We want to look at the optimal health of a patient. So is it issues that we're experiencing that patients just don't want to listen or hear any education about healthy living. And that's just, and let me clarify, that's not just exercise and eating healthy. I am looking to improve areas on all areas of life, optimal health. So that's financial, vocational, spiritual, if it's a social, if it's tech savvy. We're going to be talking about quite a few areas of a patient that may have to be improved on or try to grow from. And of course, obviously, the exercising and eating right and making sure that we're getting preventive measures, which includes vaccination. So of course, during the plan portion, you plan accordingly. What does success look like? Design and collect the data. If you're looking at your vaccines and your pneumococcal specifically, um, please let us, if you're looking at your pneumococcal, let's pull the list. Let's start tracking it. If it's a data issue that we're not entering our data, or that the data is not crossing from your EMR, your internal database, into the EQRS system, where is it faltering? We go into, as I mentioned, the plan phase. So identify the goals, establish a measured metric. If your current goal for vaccines for influenza this year is 100%, that is a good push, because you're normally at a 90 or a 95 and your goal is at 100. It may be one or two patients that you are having that hard barrier. So find out the root cause as to why they don't want the vaccines. Is it a person that they're talking to? Maybe, instead of talking to their nurse, send to a technician. So again, identify the goals, find the measurement metrics, form a multidisciplinary team. I want you to build a coalition within your team. So this is not a one-man job, and I try to stress this as much as I possibly can. It is not solely the facility administrator or your clinical manager or the social worker that is taking on the lead in this whole healthy living initiative. It takes a village to raise a kid, and it takes a village to take care of your facility. Everyone should get involved. So it may be your RD or your social worker that may be the lead, but it should be a whole conclusive team that supports the process of building this plan and working together. The next portion of the PDSA cycle is the do portion, which is basically engaging the key people, implementing the plan. So you sat with your team and you came up with this plan, and you realized that your barrier is vaccine fatigue. Patients just do not want it because they're overburdened with all the vaccines and the consistent change. Then we've already built our team and we're going to implement the plan. So the plan may be, okay, so maybe it's not the person, the nurse, that should talk to the patient. So maybe we'll get a tech, maybe we'll get the FA, maybe we'll get the doctor, the MD, to come sit by chair side and talk to patients. Maybe we'll do a on the spot, Q&A, debunking, facts and going into, I'm sorry, debunking myths and going into the fact portion. Maybe make a game in the facility so that we can, address those questions, but make it fun for the patients. Maybe we'll do a, day we're providing snacks in the facility where it's healthy, and they talk about, the RDs talking about these healthy snacks that you can make at home. So, implement, find your plan, whatever the plan is, and then of course the do portion is doing the plan. Next phase is studying it. So you've already done the plan and do. Now you've kind of let it, cycle for at least 30, 45 days. You see any changes in your facility. This is the time to start studying it. What was it that made the change? Was it the RD that, restructured the pattern of facility? Was it the FA, coming more onto the floor? Was it the technician that has a better rapport with the patients since they're with them consistently throughout the day? I know they're the ones that put them on, take them off, and the nurse may be, passing meds and doing assessments and trying to get all the information into the systems, calling hospitals. So maybe it was a flip in the dynamic or the culture of the facility. Maybe it was the games. Maybe it was the recipes. So again, this is the period for you to start studying your pattern. You had that plan, which 30 days to do, which is 30 days. And now we're studying those 60 days of looking at the data and seeing a significant change. And then, of course, the last period, which is our final month, the 6th month, is the ACT phase, which is where adjusting intervention, scaling up and sharing learning plans or best practices. If the plan, do, study approach did not work. So say, for instance, you saw your barrier and you're trying to mitigate it, and the study is showing that the numbers are not increasing, the patients are not, accepting of it. What was it? So let's go back to the original drawing board and see where the barrier is. Maybe we need to start again at the root cause analysis and deep dive a little little further into those 5 whys. We're noticing that Mr. Brown and Miss Smith decide that they just do not want to hear it. These are our final 2 patients. What is it that we're doing differently, or what can we do? Maybe we need to incorporate them into a PFR. Maybe they would be the advocate for the facility. Maybe engage the caretakers or family members. So there are areas that you can see where, if there is additional problems and is not successful, to go back to the drawing board. Now, even though the coalition may be over at that point for our end, I want you to know you could continue forward with the coalition or the plan into your facility. Are there any questions so far? Please raise your hand. You can come off of mute or drop it in the chat box. Okay. So in addition, with the inclusion letters that I sent out, I provided you with the periods that your coalition months will look like. We will also be providing the community coalition outline. And this is just a full breakdown of what the coalition looks like, what month you're currently in, what the steps you'll be taking for that month. Again, this is just an extra area, extra layer of protection, just in case you forget where you're at, what period you're supposed to be doing, what's due at that point. And inclusive of the in the outline with the IPRO Learn activities, you'll also see where it says patient focused activities. I know this is a hard area for some facilities to kind of figure out how to be inclusive of the PFR. So if at any point in your plan due study period and you're not sure how to engage your PFR, or if you don't have a PFR, please reach out at all times. Even though I am the project lead for the Healthy Livings initiatives, our PFR is Aisha Edmondson. I believe there's a portion where she talks about this in this presentation. Following your progress, best practices for internal sharing and project monitoring. As you can see, these are performance reports that if you haven't received them, you'll eventually receive them, letting you know where you sit with your numbers. So moving forward for the remainder of October, November, and December, you're going to see performance reports for pneumovax as well as influenza, and letting you know. I'm sorry, if you can put your phones on mute, I greatly appreciate it. There's an echo. Thank you. Moving forward, it'll let you know where you sit in your numbers. Now, obviously, for the month of October, you're not going to see a major increase because obviously vaccines have just arrived to facilities as far as inventory. But over the next few weeks, I will be pulling data just to let you know at least twice a month to show you where you sit. Pneumovax, I want people to be as proactive, not reactive. I know last year, quite a few facilities received many emails and many calls letting you know that we're kind of coming to the end of the year, push those numbers, but we want to make sure that we are giving you as much data as possible. So you may be receiving, or you should be receiving performance reports with a forecast to let you know where you sit with patients that might be due for pneumovax in the next month or two. On-site visits. On-site visits are we have a team of individuals. Michelle Anderson handles our Network 1 and Network 2 area. Marie Hurd is our Network 9 area. And then, of course, Joseph Kiswe is our Network 6 area. And these individuals actually will be visiting your facility. They may have, if they haven't visited your facility, they may be coming due to visit your facility. And what they are is just an added layer of support. They are there to give you additional resources, maybe by hand, may provide you, external links, address any questions that you may have, barriers that you might be experiencing. They are there for quality improvement and to help address any questions that you have. So please, if you see any one of these 3 individuals, Vicki is no longer part of our team, but we do have Joseph, Marie, and Michelle. If you do see them at any point, please do not, question why they're there. They're there for an added layer of support. They might call you, they might send you an email just to give you a heads up. And again, they're there for ongoing support of the PDSA cycle. facility network expectations of you, obviously to complete the root cause analysis. But again, this is a team of volunteers. So I know we're engaged, collaborating with your network, scheduling one-on-ones if you need to. I am always available. I'm here Monday through Thursday from 7 to 4, and then Fridays I'm here from 7 to 1. But if need be, I can stay a little longer on Fridays. We can switch up some schedules if it's conducive for you. We do monthly IPRO Learn interventions. I know, again, if you're volunteering, you're already doing the IPRO Learn activities and interventions, but by all means, if you're not, please get into the system, kind of look around, get a feel for it, and I'm going to show you what it kind of looks like from your end. We want you to share progress and best practices. I do have a discussion forum available where we're going to interact via the discussion forum, via email, via phone, whatever is easiest and conducive for you. We do have a best practice webinar series getting ready to start. One is on October 29th, and the other one, if I'm not mistaken, is on November 4th or November 6th. I'll give you the dates for that one. But it is about changing the culture of your facility. So we ask that you attend those best practice calls. It's some insightful information. It's not just healthy living, but again, healthy living kind of touches on everything: transplant, hospitalizations, home, readmissions to the hospitals, eating right. But there will be other individuals there presenting for the call. And then, of course, dedicating yourself to the 6-month cycle. Any questions so far? Okay. So as I mentioned, patient and family engagement, we are asking facilities to speak with your teams. If there are, I'm sorry, your teammates, your patients, if there is someone in your facility and you do not have a PFR, but you know in your head, um, Kathleen or Doug might be great people, or they're great advocates. They're very engaged with the audience. They seem to have a rapport with your team, and you do not have a PFR. Talk to them about joining the PFR Alliance. We are trying to have at least one representative in every facility so they can be the voice for you. We find that obviously when patients are engaged more adequately within the facility, feeling that they're part of the clinic because that is their home, then things do change within the facility. Culture changes, numbers change. You may not have as many mistreatments, hospitalizations when you have that peer support. So right now, and again, these numbers are a little dated, but as of back in April in Network 1, we had about 58 PFRs. Network 2, 152, which is the New York area, so that says a lot. In Network 6, we have had about 216. In Network 9, we had about 137. So a total of about 563, which is extremely well. But of course, the more engaged patients are, the better your numbers and outlooks will look. Patient and family representative alliance levels of engagement. There are 3 levels when it comes to a PFR or PFE. You have your PFR members, where they're like, it's like 3 tiers. So PFRs are like the introductory level. You've kind of signed them up and they're getting involved in all the things within your facility. That includes, being a part of QAPI or FHM if you are a, DaVita. Sorry, I'm still a DaVita brained. But for those that are when you do your FHM or your QAPI, they would be involved in those meetings. If they're not physically there, they can call in. We encourage the MDs and the IDT team to kind of space out some time for the patient engagement, and then you can kind of talk about maybe some quals they may have, maybe some things they want to do, some areas they want to look at that they're hearing from their other peers. Then we have what we call a QIA champion, which are basically like leads. They speak with the ESRD peers, they share advice, they participate in facility activities associated with the QIA project. So there might be some times when the network may provide like an actual task for the PFR or the PFE, and they kind of go and take it back from us to you. And then of course they have the PFR patient subject matter experts, which is PSME, which is basically the 3rd tier where you've kind of graduated, traditionally, and you become now a mentor to someone else that may want to go into that area of, being a PFR in the facility. Again, we kind of talked about PFR members and their introductory periods and where they go and the knowledge that they take. There is a monthly meeting that is handled by Aisha Edmondson. She is our PFR, a PFE manager. She is our project lead for that. And she does a monthly meeting where, again, the information that we're providing to them, they kind of take back to the facility, educating patients, educating the team of what was presented during that call. I was just on one a few weeks ago where we kind of talked about being a part of the vaccine campaign within the facility. CMS goals for patient family engagement in QAPI. It looks as though you want to prevent, obviously, we want to prevent HIPAA, obviously no PHI being going back and forth. So that's where that QAPI meeting is essential. You want to designate that 5 to 10 minutes in the beginning, or maybe at the end, or maybe there's a period in the middle where you kind of, the patient is unavailable, but they might come in the middle. And so you want to designate that time period for them to express any concerns or issues or things they want to do. Ways to include patients, offer options to present in person via report or via phone call, follow up with a patient on issues raised. Please close the loop. We encourage this so much because patients often feel like even though they expressed any concerns or issues or even just some ideas, when the loop is not closed, they're feeling dismissed and diminished. And so then disengagement happens. They no longer want to be a part of being the PFR, being the engager. So engage your audience and close the loop so that they feel like their voice is being heard. And of course, encourage open dialogue aimed at solutions. We want to make sure that if they are presenting anything that they've heard, maybe within the network through us, or maybe they went to a kidney, you know, conference that we have a patient expo that's getting ready to happen in, if I'm not mistaken, in the Network 9 area. So we're asking that if they, get that education and they bring it back to you as the team, that, you offer that education to other individuals within the facility. Again, closing that loop and making sure they feel being heard. There's also a part of the PFR where the PFE program is the life plan activities to align patients' dialysis care with the identified priorities, increase individualization, and improve the care planning process. Again, this is something that CMS is looking to increase within the facilities. Aisha Edmondson is, again, the lead on this, and she knows more about it. So if you have any additional questions about the life plan or the PFR, and the mentoring program, by all means, I will gladly get you her contact information and she can provide that as well. And as we talked about, the peer mentorship program is a relationship that benefits all parties, mentor and mentee. For those that feel that, they want to be a part, but they don't know how to get in part, this is that bridge that we were talking about where the PFR can build that relationship with that new PFR. I also want to say that if by chance your PFR eventually gets a transplant, or they're on the wait list, or they're about to get the transplant, by all means, they still can be included. We have periods where there are those that have been transplanted and may not be in the dialysis facility, but they're still a part of that clinic because they build such a community with them, and that's their village. So they may still be a mentor or mentee within the facility. Okay. And just a little bit more information about how wait a minute, there was a question before I go any further. Is it mandatory for us to participate in this? I am brand new to working in dialysis. It is part of CMS goals. So with that being said, yes, the answer is yes. However, it's not right if you're just getting started. And I do want to encourage this, Daryl. If you're just getting started, you're coming into the facility and you barely know your back door to your front door. You don't know all the policies and procedures. By all means, focus on that because we understand that no job in any capacity you're going to get immediately, but especially dialysis. I don't recommend anybody knowing their full potential in a dialysis clinic until a year. I worked in dialysis. I did it for 10 years. And so by all means, we encourage you to get all the education you can to learn your facility, learn your team, know your patients, spend that time with them. But this is a great time if you are kind of interacting with your patients, you eventually know characteristics and behaviors of an individual, and you can start feeling, I think if they're not there, I think they're going to be there, so maybe this would be a great opportunity for me just to discuss it. Does that answer your question, Daryl? Thumbs up. I'm gonna yeah, okay. All right. Any other questions before I move any further? I have two screens, so I have to flip back and forth, so bear with me. Okay. All right. So how does the peer mentoring work? They're trained individually. They're going to get some background information about how the network is here for help. How it's almost like a, again, like a schooling type of setting where you kind of go through phases and you get all the education, making sure they understand about HIPAA, making sure they understand about not transferring data and information. Um, let's see. Just trying to make sure I kind of cover all bases. And again, if additional information or more support can be provided through Asia Emerson. They're looking to connect with peers, and that's pretty much how it works. It's basically just like a tier level. And once you get to a place where you want to be a mentor, it literally is classes you do have to take to make sure I say I graduate and now I'm a full mentor. Um, okay. Network expectations of you. Sign up a PFR to work with the network. So that again, answering that question, Daryl, nominating somebody or recommending somebody, or maybe speaking to a patient that says, I think you would be a person, and that person declines. And so you can say to them, well, who else would you think would be a good person that you know will fit this characteristic? Encourage your PFR to attend the PFR Alliance call hosted by the network. That's that meeting I was telling about on a monthly basis where they get great education, additional information to take back to the facilities. Keeping them engaged during the PDSA cycle. Again, following that outline there, it correlates to the month of what a PFR should be doing or should be participating with. And again, if you do not know how to apply your PFR, because there is that period where you're like, well, I don't know, should I let them be involved? I don't know how to get them involved. By all means, call us and we can always tell you what's the best thing, because your plan will reflect whatever you're going to do with your patients. So your PFR does need to be in line with that. Get your PFR and your other patients involved in QAPI as we requested. If you're not doing it and you do have a PFR, now's the time to get them involved in those QAPI meetings. And then, of course, inquire if they want to become a peer mentor. Okay, so platforms, iPro Learn. Everybody should have been in iPro Learn, has seen iPro Learn, has been part. I see head shaking, so yes, um, you have seen the interventions. So iPro Learn is where you go to definitely look at some of the resources that we're providing to you, be engaged, and of course, it is part of CMS guidelines to be collaborate with us, work with us. And there is a lot of great resources on there, not just for healthy living, but there was in home where there was a resource provided on body shaming. So if you have PD patients or you have patients that, are on the cusp of trying to go home and they're, unsure about the whole PD catheter hanging out the stomach, absolutely, this is a great, resource to provide to them about, areas where they should feel more comfortable. And again, explaining that it is a healthier lifestyle going home. So again, this platform is available 24 hours a day, 7 days a week. We provide announcements right now on the website. If you have already been on there, there's information in regards to the emergency management due to Hurricane Helene, and obviously now Hurricane Milton for areas that might have been impacted. I don't believe any of our networks were, but again, we're still kind of going through that. Baxter is a big issue as of right now for home because of PD solutions. So again, we provide announcements, symposiums, classes, CE classes. We offer maybe meetings that might be happening within the community or meetings that we're providing, which is the best practice calls that's getting ready to happen very soon. And then, of course, a discussion board. So this is what the website looks like. And when you log in with your facility username and password, this is what you're going to see. A lot of areas that are mistakes that might happen where maybe Karen might be your FA and she signed in using her personal login. You're not going to see any of this. And if she does any of the things on her login, it's not going to show up for the facility. So make sure you're using the facility username and password. And if you do need that information, let me know and I can make sure I get it to you via email. Once you get into the system, you're going to see the dashboard, which is basically this information up here. It'll say home dashboard in my courses. On the left-hand side, you'll see what's new. So maybe if, do we have questions? Okay. Maybe on the left-hand side, you'll see what's new, recent announcements, coalition work, to do activities. And then, of course, when you kind of look in the middle, it's going to show all that information. Back then, we was offering open office hours. By the way, that is getting ready to resume again for the data department. I'm always on there every month, October, November, December. I will be there, where we're offering questions about anything related to data, 2746s, 48, 2728s, especially during that annual 2744. There's a lot of questions that might come in, but I'm there to talk about vaccines and making sure that we're, updating our data records on a conclusive, continuous basis. But anyway, on the right hand side, you'll see QIA formers and toolkits. And as you can see, there's quite a few different departments. We used to have depression, but if you still have a question about forms, it still should be there. There's a new one up with the emergency management preparedness. They have a beautiful new emblem there. Healthy Livings is there. Home, hospitalizations, nursing homes, transplant, and telehealth used to be, but I believe we've probably moved that. But again, this is a great area for you to see discussion forums. This is where I'm going to be presenting questions. This is the area for best practices to take place. Maybe facility in network 6 might have a question, and maybe network 9 can answer that question. We're not asking that you have to stay within your network. This is a great time to get insight from different areas. What are you doing in your facility that's changing the outcomes, or that you're seeing differently? Okay. Um, as I discussed, the forms and toolkits is a great resource. The form down here at the bottom, you'll see where it says vaccination form. This is what the discussion board will look like. So there might be a question I presented recently where we was talking about pneumovax. Are you eligible? That was a question I asked. However, what I was providing was a link to the CDC's pneumovax advisor, med advisor, which was an algorithm. You basically signed in, answered a couple of questions, and it told you exactly what steps you needed to take to provide the next pneumococcal vaccines. We know that there were some questions and legitimacy of the PPSV 23, if that was still being offered. It's no longer considered the up-to-date vaccine. However, some facilities still are giving them. So if you're still giving the PPSV 23, you follow the algorithm and it'll tell you when to provide the PCV 20, or if you need to provide an additional 23. For those that received the 13, for those that received the 15, again, that algorithm will provide the steps to take when you go into the system and when you should give it. Okay. Um, at the top, it's an improving healthy living vaccination rates toolkit. And that was that toolkit that I was talking about, where it's a great resource to kind of, if you're looking for things. Okay. So I try to keep it updated as often as possible. We provide all the resources that maybe, I've had in the past, maybe I've recently done. We have Healthy Living Bingo in there. We have the Pledge to a Healthier Living that's in there. And then moving forward, one of the things that I did when I updated the toolkit, I asked facilities, tell me what more you would like to see in there. What other additional resources would you like to see, or information you would like to look at? And I got quite a bit of good feedback. So moving forward, you're going to see things related to vegan options or vegetarian options, resources or community resources where they can find um, community aid. So maybe a food bank, maybe it's vocational help, maybe I'm looking to see what steps I need to take to get a transplant, BMIs, things of that nature. Moving forward, you're going to start seeing the toolkit kind of expand a little bit more, but I do want to let you know that that is available for you for added resources. And if you're looking for the information, it will all be in there. Coalition work. Um, as I mentioned, when you get into the dashboard and when you log in, you're going to see this little area that says Community Coalition 8, and it will tell you if you belong to Healthy Living C8, or if you belong to home, or if you belong to transplant, it will have that link for you to go in. And then once you go in, your interventions and outline will all be available for you. And then, of course, once you've completed the activity, it will say complete the activity and it will say done. And then that will be checked off your box of tasks to do. I do want to provide that there is a fresh desk or a help desk for any questions that you may have. If you're not able to get into something, if the login doesn't work, um, if you're having any issues reviewing the information, maybe you're supposed to be part of home, you thought you was home, but maybe it's healthy living, or maybe, and I do want to express this, I have in my past, and I may in the future, accidentally send the wrong information to the wrong department. By all means, this is a great area and tool for you to use. If by chance you got something, you have a question about it, the help desk department is available 24/7 via online, and they will address those questions and get you the right information that you may need. Um, we do have a website. It is the ESRD website. Again, the resources will be available for you. Additional information about what the network is, how we are inclusive, how much support that we provide is available in the ESRD website. Now, I do want to say we are in the process of reconstruction, so it may be a little dated and there may be some additional tools that you're looking for, you don't know where to find. Please reach out and we can get you in direction so that you can get those resources. Okay. Whew, so we are halfway through. I promise I hope to not keep you too much longer. Question on the floor. The influenza vaccine, when putting into EQRS, asks which vaccine that was used. I'm putting unknown. The box does not indicate which it is. I'm sorry, Patricia. Do me a favor. If you can come off of mute and just explain a little bit more. Are you there, Patricia? Okay. Okay. Let me the influenza vaccine when putting into EQRS, which vaccine that was used. I'm putting unknown. The box does not indicate which it is. Um, we'll talk off via email, and if we can review that question. I'm not exactly sure. Are you saying that when you go in and try to check the vaccine that you're using in your facility, you don't it's not listed, so you have to put unknown? Yes. Okay. I will get the answer for you, okay? Um, recently, and let me just also say this, you're very welcome. I had to think about that one. Recently, EQRS has had some updates in their system where they've listed quite a few of the flu vaccines that's being offered out. I know there's Fluzone and well, a whole lot of them. There's quite a few of them available. Let me deep dive into that a little bit more. I just want to make sure that that's not the case, that if you then it's not syncing up well. So I will get back with you, Miss Ricketson, and give you an answer. Any other questions? I'm sorry, my nose has been itching all morning. Okay, healthy living initiatives, vaccination, and healthy living goals. So you are the first to hear this. I have not put it out physically, but I want you to know CMS has made some addendums to their goals this as of recently. We are now focusing on obviously influenza for patients. The goal is no longer 90%, is 80%. But again, you all volunteer, and I have looked at your numbers, and I'm looking at 90s and 95s and 98s and hundreds, and I'm like, okay, so 80 is not. It should be far-fetched from you. It should be like in the past, like we can bypass that all day. But again, the goal for CMS now is 80% for patients. We are not monitoring. Let me clarify this. We are not monitoring influenza for staff. However, I do want to encourage you want to make sure your staff is vaccinated. They are caring for your patients. You do not want them coming in with, various diseases and sicknesses and bacteria and viral infections because our patients are immunocompromised. So yes, I still would love to see those numbers in NHSN for our staff if they're getting the influenza vaccine. Okay. Um, Also, COVID. Because we are post-COVID, CMS has recognized that due to, fatigue and because of the fact that the vaccines have changed so consistently, that has now come off of the goal. However, I stress this more importantly, We want to make sure that we're doing everything to give our patients the quality of care that they need. So if your facility is not offering COVID, that does not mean we don't talk about it no more. We still want to encourage them to get the COVID shot. Go to Walgreens, go to Walmart, go to CVS, PCP, by all means, because again, COVID is up. We are in the trifecta period: RSV, COVID, and influenza. So again, encourage it. And again, encourage it for your staff. We are not monitoring it, but I still do go in and check and see if NHSN is being updated. And pneumonia. The rate this year is a 10% increase. So if you had 5 patients that, say your clinic has a total of 10 patients in your clinic, I know that's far-fetched, but anyway, say there's 10 in center, you got 5 vaccinated for pneumo, let's push for that 10%, let's push it up to 7 to 8. By all means, all of them should be vaccinated, but again, we know there are some that will still continue to decline. So I have talked about the coalition and the ways to keep the team involved. Again, it's a group approach. I talk about the Tuckman model, which is basically forming a group, a team within a team that wants to do the healthy living initiative. Again, storming, building trust within the team, finding out who has the areas of strength. What are your strengths within the team? And again, it could be the fact that maybe I'm not a talker, but my friend Cleo here, who is the nurse, she is the talker. So find your strengths and have them participate in their strengths. Norming, everyone understands the importance of the work. This is a team effort and everybody has to be engaged. Performing, trust is built and everyone is motivated to work towards a common goal. And of course, adjoining, reviewing, assessing, celebrating your milestones. Milestones are wonderful things. Even if you are at a 90% in your influenza and you hit 90%, that is a milestone. You absolutely caught the same number and it was a great thing because nobody declined. Um, there are some best practices that I received from previous teammates. Again, success of the team. If you have those individuals that are fighting the vaccine or saying no or declining consistently, get your MD involved. These are just some best practices. Get the technician that they talk to on a regular basis. Maybe it's Sharon that has the rapport with the team, or rapport with the patient. She's just that bubbly person that comes in live and jovial and jokes and laughs, and she can get the message across. By all means, include her. Maybe it's, they're not good today, but come back in a week. They might have a different approach. It's just the timing of things. Any words of wisdom, explain the importance, educate your patients. I know they're tired of hearing it, but by all means, education comes in a number of platforms. It's not just providing materials to read. Some of your patients may have health literacy issues. And so maybe all that extra information on that paper might be too much. Downstream it. Give them a video. Show them a video on your tablets. Maybe talking to them is it. So again, education comes in various platforms. It's not just the physical papers that come from, the resources we provide or even the resources your facility provide. It may come in another form. It may just be that one-on-one interaction. Just to give you some highlights, excuse me, of the coalition, I just finished up this last coalition. We received quite a bit of feedback from the participants. Excuse me. The questions I asked was, did they implement the plan? As you can see, we had 88% of the 100% that implemented it. 79% said that they did see an increase in their numbers. And then, of course, throughout the coalition, I talked about the open office hours. Did they get involved? Because, again, I send that invite out. 88% said they was absolutely involved during the open office hours, and it was very helpful. And just to give you just a little bit more backlog with this last coalition, I asked, 2 questions. One of them, obviously, what did they see the strengths and benefits, and what did they see the worst? And some of the, obviously, some of the facilities came back and said we couldn't implement it because it's not the season yet. Obviously, we have a plan, but we just haven't applied it. But the takeaways that I got was more patient engagement. opportunity to look for other ways to handle barriers, hashing out ideas to develop the plan. They took it as a team approach. I didn't do this by myself. This was a group, so we all had plans. Understanding again that this is not a one-person job and it's inclusive of the IDT team. And what I really liked at the bottom was knowing that the data for vaccination is cleaned up. We are ready to do flu shots next week, and then they're offering looks like the COVID vaccine. So there is outcomes and takeaways from this coalition. I do have a question. Vaccines are the patient's choice or mandatory? Don't they, at the end of the day, have the right to refuse the vaccine? I'm just trying to. Yes, Daryl. Absolutely. I cannot stress that enough. Vaccines are a choice. Everything in life is a choice. Living healthy is a right. You don't, we're not forcing anything on anybody. However, we encourage it, obviously, because their bodies and their comorbidities they may have. We want them to see a healthier life, a quality of life. So yes, if a patient consistently declines, I don't care if you had 5 people go to that patient on various levels, very different job, and they still decline, by all means, they decline. You can't force a patient to take a shot. However, there are those periods where a patient, the first 2 people said, they went to him or her and they kept declining, but that third person was able to finally get them to do it. When you get that, give it. And I can't stress that enough, because if you wait too long, that patient will go back and say, no, I don't want it now. Immediately. I can't stress that enough. But yes, to answer your question, it is a choice. It is not mandatory. Resource highlights, healthy living. So again, as I mentioned, this is you're very welcome. These are some of the resources that's in the toolkit that's on the ESRD website. The Join the Movement, Take the Pledge for Healthy Living. We have Healthy Living Bingo, where we provide all the cards. The only resources you need to have is either a pen, or if you have bingo chips, or if you have the bingo popper, which by the way, I love bingo. So that little marker is a wonderful thing. We also have the Healthy Living Champion Checklist. If you do not have a wellness champion in your facility, get one that wants to be involved. Again, it's a person that enjoys educating or maybe live a healthier lifestyle. And it doesn't have to, again, always be physical or nutritional. It can be just a spiritual level. So again, these are the resources available. We also have the guide to symptoms, if it's a flu or is it COVID or is it a simple cold, the steps to take in the event to avoid patients going to the hospital. You want to definitely utilize this resource. And of course, we provide a vaccination record book for those that still write information down. Protect yourself, get the vaccines you need. This is just a breakdown of what vaccines are provided within the dialysis setting and why you need them. Stay safe this winter. Again, this is education on, I'm sorry, education on why you need your vaccines and what you need to do, washing your hands. I know that's a big thing for patients coming into facility. They don't often wash their hands, but this is a period where maybe this is your barrier. Let's start washing our hands. Maybe start putting up displays and washing your access before you get in the chair. Culture change starts with one person, and then it eventually trickles down, but it has to be consistent. And then, of course, we have the change package to increase vaccinations, which is also available in the toolkit. Moving ahead, continue encouraging and educating about the importance of vaccines. Obviously, we are in that season, and the benefits to the overall health of healthy living. Emphasize the importance in working with your MD to help encourage vaccines. We do understand that the medical directors may not round in the facility, but you have a nurse practitioner that does. Work with your nurse practitioner. Again, encourage it to make sure it's part of their better life plans. But it's not just vaccines, and I cannot stress enough, it's preventive care. So that includes visiting your PCP, going to get your foot checked, your podiatry appointment, going to get your eyes checks and your dental appointments, getting those annual checks, your colonoscopy, making sure you're getting your mammograms, making sure you're, doing everything necessary to try to continue with a quality of life. Include your PFRs, working with the IDT team. If you haven't started the campaign yet, and I do want to definitely stress we are in that period of vaccine season, maybe your campaign is, save a life, get a shot. Include your PFR. Maybe they might want to be the first point to get the shot in front of their peers. And then, of course, share your best practices through the dashboard, through the email. Again, you're going to hear from me quite a bit because, again, this is the volunteer team, and I cannot express and thank you all enough for that. Okay, I said a lot in 50 minutes. I really did try. I'm trying to give you some time back. Are there any questions, comments, concerns, feelings, thoughts? You can take off mute. You can ask the questions. Okay, just want to confirm that the procedures for this project can be found. Yes, they are going to always be available on IPRO website. Again, utilize your facility user, and password information to get in. I will also be sending emails out to let you know, hey, look, this is the time. Go do your RCA. You're going to receive reminders from me via email, and it's always going to be available on IPRO Learn, as well as the discussion board. Any other questions? Please feel free, throw them at me. It looks like, okay. So I guess I don't have any more questions. I am going to send out this slide presentation via email to everybody so they have it available for review. My information will be available. My contact information will be available. I'm going to do something a little different with this coalition, but I am waiting for your RCAs to figure out how we're going to move forward. Okay. But again, you are always available to reach me via email, via phone, via chat, via Teams. If you have any questions, or if you want to get more information, I can get you to the person that you're asking that question about. It could be about the PFR, it could be about transplant, it could be about home. We have leads for every department. Again, I do not want to take up more of your time. I'm giving you 9 minutes back. I know how the flow works. Thank you for joining. I will be on till 10 o'clock if you have any additional questions. Thanks, guys. I see there's still individuals on. Does anybody have any questions? Okay. Hi, Linda. Linda, if you can hear me, can you thumbs up or put a message in chat? Okay. I'm going to email you. Our meeting ended about 10 minutes ago. I'm going to disconnect the call if nobody has any additional questions. Okay.